Hi, I'm Geri Catton, and I'm a nurse navigator here at MultiCare Yakima Cancer Center.
So, Geri, thanks for joining us today. We're so excited to get to talk to you as Oncology Hero of the Month for January. Can we just start out with you letting me know what inspired you to be a nurse navigator?
Oh, I have been an oncology nurse for almost 40 years. I celebrated my 38th year of nursing, and all of it has been in oncology. And I started off as a bone marrow transplant medical oncology nurse at the University of Washington in Seattle, then moved over to Spokane and was a clinical nurse educator for staff and patients on the oncology unit there at Deaconess Medical Center, then helped start a clinical trials unit at Sacred Heart in Spokane, then came back to Yakima when my husband decided that this was going to be a good fit for his internal medicine practice, and we settled down here. I took a little break, had lots of children, actually 5, and
Wow.
took a break, stayed home, and then came back into nursing about 10 years ago. So at that time, I came back into clinical trials nursing and was invited to join a nurse navigation team here that was just getting started. Medicare decided about 5, 6 years ago that they wanted to streamline oncology care. They were spending exorbitant amounts of money on their cancer patients, and it wasn't the cancer treatments that were so expensive. It was the extra costs of patients going into the emergency room for common symptoms like nausea, vomiting, constipation, things that could be easily handled by someone who knew what was going on with the patient and could proactively get in front of things. And so that is why they've decided to go ahead with this oncology care model. And that was where they took 200 centers across the country, both small community centers and large universities. And I had a good cross section of hiring nurse navigators to deal with Medicare patients and see if they could help proactively navigate patients so that they didn't have all of these emergency room visits and had a better journey. And so they found that it was hugely successful, and they decided that the model was good. They would endorse nurse navigators. So about 3 years ago, that model ended, but navigation has continued. And I now navigate patients in the GI world, and I have really enjoyed this ever since then.
Wonderful. Well, you're doing so much good, that's for sure. So, when you wake up in the morning and you think about getting into your role as a navigator, what is it that motivates you?
I really enjoy coming alongside patients and walking the cancer journey with them. Cancer is probably one of the most devastating words in the English language. When a patient hears that for the first time, they honestly don't know how to cope with it. They start thinking about what they're going to do, where they might get treated. They immediately go into okay, I'm going to die from cancer mode. And I get to come alongside people and explain the process, explain the next steps, help them see that we just go through the journey and I'm there to walk with them. It's really helpful to patients and their family members when they have someone that they can call or sit down with and go over things, whether it's treatment, side effects, a report on a study that they don't understand, or what a tumor marker means, anything that has to do with cancer. I get to explain to patients. I know that my patients feel as though they are having someone walk through with them.
Absolutely. Gosh, as having been a navigator myself, I remember that feeling,
Yeah.
taking them by the hand, figuratively or literally, and just making sure they know that we're there with them. They're not alone.
Right.
So,
Right.
tell us about an impactful moment that you've had in your role. What comes to mind?
I think that one of the most impactful things for me is just being able to identify a patient up front that may have had a delay in treatment or slipped through the cracks if they hadn't been identified, being able to navigate a system that is very difficult for patients, especially those with barriers to care. And what I mean by that is somebody who maybe has English as a second language or really has a very low health literacy and doesn't understand that when they're supposed to call and schedule a CAT scan, they're waiting for someone to call them, and so they don't know that that's not going to happen. One of the things that I think has been super impactful is a patient that just recently came into my world, and he was a 32-year-old Spanish speaking gentleman who was admitted to the hospital, had recently moved from Guatemala to our local Yakima area, and had acute abdominal pain. So in the emergency room, they did imaging. They found that there was a huge liver mass that was connected to the pancreas. And then they called the medical oncologist to say, what should we do next? And he advised a biopsy. Patient did have a biopsy within the next couple of days, and then felt well enough to go home while the pathology had not resulted yet. So the patient was instructed to follow up within a week or so with the oncologist. The patient did not do that. And so I was working with the new Azra AI application, and this patient fell into my GI filtered queue. And I realized that there were no follow-up appointments scheduled. So I went to talk to the medical oncologist who had recommended the biopsy. And he said, oh, we need to get that patient in. Did they not send a referral? And sure enough, a referral had not come yet. So we were able to get that patient in, get them on tumor board, discuss the pathology, discuss the radiation or imaging that they needed to have, and get that patient in to be seen. Patient got to start on treatment the following week, and I just looked at his chart a couple of days ago, and he's actually doing quite well. He's been connected with both the pain clinic, who's managing his pain now. He's got social services on board who have given him resources to get to and from treatment. He's also got a palliative care referral now that is helping him figure out what is he going to do when things aren't going so well. We don't know how this patient's going to do. He was diagnosed with a very difficult to treat disease, and he may or may not respond, but at least the Azra application gave him a fighting chance. Otherwise, we may not have seen this patient yet, and it's been about 4 weeks. That's probably impacted me the most.
Gosh, it sounds like having just come here from another country, not speaking the language here, I'm sure he felt really alone and pretty lost. He was so lucky that you got in contact with him and helped him understand what's next, in addition to the fact that you got him to care much faster than what would have happened otherwise. So that's an incredible story. Geri, what's one piece of advice that you'd give someone facing a cancer diagnosis?
I would say never be afraid to ask questions. If you feel as though things aren't moving the way you were told that they would move, I would make a phone call to the doctor who told you they were going to refer you for either a scan or a biopsy or to an oncology facility. There are people that will talk to you, and I would say be your own advocate. Another thing I think I'd say is make sure that you do understand what your physicians and nurse teams are telling you. If you don't, please ask questions, because it's our job to make sure that you do understand and that you do agree with the treatments we're wanting you to move forward with. And if you don't, we need to talk about that some more. And this is not the day and age where whatever you were told you had to do. There are choices, and we want to make decisions with patients, not for them.
You bring up such a good point. I think nurse navigators are always really sure to remind patients that they're part of the care team, that their voice matters. And you're right, so many don't understand that that's part of the process. And just having a nurse navigator or a patient navigator empower them with that thought is huge. That's tremendous. So, what's one piece of advice you'd give to somebody who's new to nurse navigation? You've got experience in nursing in general, and you've been doing this for a while. What would you tell them as they started out in this field?
Don't worry so much about all of the details, but think about what is the best patient-centered care I can give this patient in front of me. Sometimes we think of all of the patients we need to deal with and all of the different needs. And really, it just comes down to one patient at a time, and thinking about their care and what their next step is and what is your next touch point with that patient. You can go down the road and look in the future, but really just take it as it comes and then be willing to adapt or adjust your plan of care based on the information that you have and through talking with the patient. There is nothing that beats talking to a patient about how they are perceiving their treatment is going, or do they understand what is next on the program for them? Have they made that appointment for the next CT scan so that we can really see if the cancer treatment is working the way that we think it should? And I think that so many of us get bogged down with the details or the administrative duties. But really, if we just keep our patient centered activities in front of us, that's the best thing to do.
I love that. And you're right. Navigators often have a lot more time with patients than other people on the care team. So sometimes we get to tease out that critical idea or piece of information that we can then share with the others on the care team that might make a huge difference in their care. So that's a really great point to focus on that patient in front of you. All right. Now to you, Geri. What ways do you prioritize yourself so that you can make sure you're showing up as best you can with your best self for your patients?
Yeah, I think that that's such a great question because if you don't take care of yourself, you really don't have a lot to give. And if you're giving so much away, that's why it's really important to rejuvenate and to really be able to come in with just knowing that you're there for that period of time with these patients. And I think that it's really important for nurse navigators, nurses in general, to take time for themselves and really rejuvenate, just figure out what is going to allow you to get rest, to feel good about what you do.